Elizabeth Warren didn't come to hear excuses. She came with facts, and RFK Jr. had nowhere to go.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, "If vaccines are working for somebody, I'm not going to take them away." No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise, Mr. Kennedy.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm
she
not
was
surprised about that.
pre-approved. So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get this
witnesses.
straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar? Is
Yeah,
that what
you
you're
should
saying?
ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I
you.
was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you are putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Senator Elizabeth Warren came into this hearing with one goal: expose the gap between what RFK Jr. promised America when he sought this job and what he's doing now as head of HHS. And she wasted no time making that conflict crystal clear. She reminded him, in his own words, that he promised he would not take vaccines away from anyone who wanted them, no exceptions. But then he turned around and announced that the COVID vaccine is no longer recommended for healthy people under 65. On paper, he claims anybody can still get it, but in the real world, that's simply not how health policy works. When a vaccine is no longer recommended for a group, pharmacies stop offering walk-ins, insurers stop covering it, states shift supply away. So even if something is technically available, everyday people lose practical access. Warren wasn't arguing theory. She was pointing out how these decisions play out on the ground. You promised people they could get the vaccine last month, but this month you've made it harder, more expensive, and in some places impossible. And Kennedy struggled because Warren wasn't debating politics. She was talking mechanics. Healthcare access isn't determined by slogans, it's determined by recommendations, coverage rules, and state-level implementation. Kennedy tried to hang on to the phrase, "anybody can get it," but Warren kept returning to the real-world consequence. If someone goes to their usual pharmacy and gets turned away or handed a $200 bill, that's access denied. Then the fight escalated further when Warren brought up the firing of the CDC director. According to her, the director pushed back on Kennedy's changes to the vaccine schedule, and within weeks she was gone. Kennedy admitted he demanded her resignation because she told him she wasn't trustworthy. Warren's point was not about personalities. It was about the danger of turning scientific agencies into loyalty tests. If experts can be removed simply for disagreeing with political appointees, public health stops being science-driven and starts being fear-driven. By the end, Warren painted a picture of an HHS making decisions that could weaken vaccine access nationwide and destabilize trust in the agencies meant to protect families, from seniors in nursing homes to parents trying to keep their kids safe. Her closing line made the stakes clear. You are putting Americans' health at risk, and you should resign. This wasn't just a clash. It was Warren trying to remind America how small bureaucratic decisions ripple outward into the lives of ordinary people. And whether you agree with her or not, the underlying message is worth hearing. Access isn't about what's theoretically possible, it's about what real people can actually get. If you want more breakdowns that turn heated political moments into clear, real-world explanations, make sure to subscribe to Left Lens and hit the bell so you don't miss the next deep dive.